V Boutique. I'm excited today for our Facebook Live event. We are going to talk about ThermiVa today. This is a fairly new technology. We've had a couple of videos online on our website and Facebook about it before, but I've never had a Facebook Live about this. And for the first time today, I actually went out and invited personally a lot of people to join because I think this is a very important topic. ThermiVa, this little machine here basically, is a radiofrequency device that helps to restore the vaginal tissue. So what do we mean by that? Several things. Let's start with younger people. If you're younger and you have sexual dysfunction, you have desire issues, you have anorgasmia or problems reaching orgasm, or you just don't like to have sex very often, this helps a lot. So that's, first get that out of the way. So there is a place for this for young people. When you enter into your perimenopause and postmenopause, then the issues become completely different. Then you have hormonal issues, then you get into dryness and postmenopausal vulvovaginitis, which causes painful sex, severe dryness, and actually becomes very painful, and because of dryness issues. This machine is very effective in restoring the health of the vagina. So it creates moisture, it completely revives and rejuvenates the linings of the vagina so they look young again. Not just look young, but they feel young. So you create that moisture that you had when you were young, and as a result the sex isn't painful anymore. So this can actually save your marriage. More importantly, I think, for around that age, or anybody who's had a couple of kids who has experienced some degree of urinary incontinence, this device is truly a life changer. It can help anybody who has anything from just like dripping because of urinary incontinence to full-blown wearing a diaper, you know, whatever, pads, and God knows I've seen women over the past 10 years every day. It's amazing how many of us walk around with pads because we leak all the time. You get a series of 3 treatments with ThermiVa and we can eradicate that pretty much. That's why I'm excited about this, and I wanted to call it Vagina Dialogue because, you know, we used to have the Vagina Monologue years ago and Oprah started it, but I think we need to talk about these issues a little more openly and frequently, and come out of our comfort zone and put it out there. So I want everybody to come out and ask questions, and we will be happy to answer them. A little bit more about the technique itself and what it entails. So ThermiVa utilizes a wand, which is about this size or slightly thicker, just about this size. So we insert this inside the vagina, and we can use it also around in the labia area, all around the tissues, so to create gentle heat. And the way that heat is targeted, right around 45 degrees, it causes significant rejuvenation of the tissue in that area over a series of 3 treatments. The treatments are roughly about 30 minutes, and during that 30 minutes, you just have a slight sensation of heat. Patients actually describe it as very comfortable, sometimes too uncomfortably comfortable, and there's really no pain at all, and there's no downtime. So you basically come here, have your treatment, pull up your pants, and get on your way. You can have sex that night, swim, go out, whatever you want to do. We do a series of treatments 1 month apart. The reason we need to do a series of treatments is because we need to get longevity. If you have just 1 treatment, you'll have an improvement for a short amount of time. But in order to get the longevity of the treatments and the full correction of both urinary incontinence and all the dryness issues, you need to have a series of 3 treatments. That's strongly recommended. The device is FDA cleared for this purpose, is the toast of the town, so to speak, in all of the laser and conference meetings that I've been going to recently. The report on it from both our patients and the medical community is that one of high satisfaction, truly, and again, life-changing. Our experience has been that women come in for both issues, urinary incontinence and dryness. Urinary incontinence is a little bit more common in our practice, I think, because of age, because, you know, Florida, we have a lot of older people. If you go to other parts of the country, maybe a little bit more of the other. It also, this is a very personal issue. If anybody has issues with the way their genitalia looks, if there's laxity on the outside, I can't show the before and afters here, but we can show them when you come for your consultation. the transformation is amazing. You know, you can really tighten the external tissues significantly. Now, this is something that is very personal. If you don't mind, you don't mind. But if you do, or if your partner does, this is a very easy way to treat it. And this is the only device in the market that can both treat the external tissues and internal tissues at the same time. So in that sense, it's very unique.
We have a question.
Okay.
What is the average age of a patient who can get this?
There is no limitation for any age. Anybody can have it. Again, younger people may want it because of cosmetic issues, or because they want to improve their sex lives, or because they have problems with orgasms and things like that. Because this treatment works because it increases blood flow. That's how it really works. And that's how it revives the tissue there. So it can be, we've had people in their 20s because they want to improve their sex lives, or they have problems with their partner. They are very satisfied. We have people actually as high as in their late 70s and 80s who mostly want the treatment for urinary incontinence. And because it can treat a variety of things, it can be offered in a wide range of age of patients. So,
is there any pain?
No pain. Again, the wand is about this big. The treatment involves going inside and around the vagina for about 25 to 30 minutes. No pain. Just gentle, gentle heat. No pain whatsoever. It's very comfortable.
Is there any preparation before the treatment that's required?
There is no preparation required. Yes. So you come in, you get your treatment, and you leave. And I know there's other treatments and laser devices available. The difference between this and those treatments is the other ones require you to not have sex and have a downtime for several days to weeks. With this, the good news is we don't do that. It's just no downtime. Also, it's painless. And it also treats the external tissue as well as the internal tissue. That's one thing that this device does that no other device in the market can do. It's a very, I think, life-changing procedure. Of all the things that I've offered over the years, this is the one that I think I like to really open up the discussion with women more frequently, because we tend to not want to talk about these things. You know, I'm a doctor, so for me it's, you know, easy, but most women don't want to talk about these things. And why shouldn't we? Again, that's why I like to call it vagina dialogues. Let's talk about it. Let's talk about all these problems. You know, men have it all. They can treat these problems. They have, you know, their Viagra, they have whatever, you know, but we don't. This is the first time we've had something that can help us in our sex lives significantly. You know, how many of us walk around unsatisfied or, you know, unhappy in our marriage or relationships because of this? Or how many of us are really suffering from urinary incontinence day in, day out and don't talk about it because we're embarrassed? And I can tell you that the results of this for urinary incontinence are nothing short of magical. People really, really are very happy with it. We've had many patients that even completely, that have been wearing diapers and pads for years, and after the second treatment, they throw them all away.
So we have another question. How many treatments does it take with the urinary incontinence?
3. If you want real treatments and you want longevity, we need to have 3 treatments. Right now we're offering special pricing packages for this particular event. So we are offering $500 off a package of 3 treatments, or you can have $250 off your first treatment just to come try it and see that it's comfortable if you don't want to commit to the full thing. But definitely a package of 3 is recommended.
Okay, and then we have another question. What age group is this for, and how long does it last?
Again, it's depending on what you need it for. Anybody can use it. There's no limitations for any age. If it's cosmetic, it's usually younger people. Postmenopausal vulvovaginitis or dryness, you know, that people typically try to help with creams and it doesn't work as well. Or with oral, you know, estrogen, it can be used for that, for older people, or incontinence in any age group. And what was the other part of the question? How many treatments is typically 3 to get, and the longevity is about a year. You don't need to do 3 treatments again. We recommend you come have 1 treatment to maintain your result once a year.
Okay. Great.
And one more thing that I want to point out actually is that the alternative to this particular thing, treatment of urinary incontinence or significant vulvovaginal laxity, in the past has been a big surgery that is very complicated, very painful, and has a really big downtime and a high risk of infection. So with this procedure, we can really offer basically the same result. You know, with fillers we always say don't expect facelift results. You can get great, but not exactly the same. Now with this, we can offer you actually surgical results without the downtime and cost of the surgery, and I'm very comfortable to say that because you actually can get those results without any of those complications. And you can avoid being on hormones for a very long time for, you know, issues such as dryness and things like that. So there's no side effect to it. It's safe. Hormones have their own issues sometimes. Now, if you need hormone replacement for, you know, general hot flashes or other things, that's a different story. But if you're using hormones, either locally in terms of vaginal creams or, you know, pellets or something, just for this issue, for dryness, you could basically replace it with ThermiVa and have awesome results.
Great. Thank you so
Thank
much.
you very much. Please call us and schedule a free consultation and enjoy the discounted price. Thank you.